Gotcha.
There you go.
Okay, today we're going to do some palpations and some special tests on the lower body, specifically the knee. We're going to start by palpating the patella, which is our kneecap. We have the superior pole at the top, inferior pole at the bottom, the medial border, lateral border. We have the patellar tendon running across, or running above the patella.
Yeah, you can just really just do, you'll see it like up the tendon that most people talk about.
And does it insert into the tib 2
I think so.
origin? Okay, I think it,
Around there, yeah.
perfect. And then we have our distal quads. All of our quads are going to attach right above the patella. We have our distal hamstrings and our hamstring tendons. That's going to be on the posterior side, and it's those guitar string-like, well, holy smokes, guitar string-like muscles there, and those tendons there. Our lateral femoral condyle. I'll have you bend your knee. I'm going to find that joint line to find the lateral and medial femoral condyles. I'm just going to go up and out just a little bit, and we're on condyle to find the epicondyles. We're going to go a little bit further out, a little bit further up, right there. We have the head of the fibula, which is going to be this bone sticking out posterior, on the posterior lateral side of that knee. And we can find that, I believe, by finding our epicondyle. We can kind of slip right below that and find that there. We have our LCL and MCL. So our MCL is going to run from the end of like our distal quads across the medial side of our knee here. LCL on the outside. ACL and PCL are so deep we can't palpate them. The IT band is going...
Make sure if it asks for ACL, it's going to be ACLs like this and then PCLs back here.
Gotcha.
So just do that for the palpations.
Perfect.
You can't actually touch them, but that's what you do.
ACL, PCL, MCL, LCL, IT band. It's going to be running on the outside, the lateral side of our leg. That's going to be running from about our...
It starts all the way up.
Oh, okay. Around the iliac crest, but below the iliac crest, like right here. And that's going to run all the way down, and it stops here, right?
Yeah, around your epicondyle.
Gotcha. Okay. IT bend, running on the lateral aspect. We have our sartorius, longest muscle in the body. That's going to run lateral to medial, longest muscle in the body. Fun stuff. Now we're going to move on to our palpation, or our special test. So first we have our sweep test. This is fun. Just going to apply pressure to proximal, distal, and lateral aspects of the patella. So I'm going to squeeze and then apply a little bit of pressure on the exterior, or on the lateral side of the patella. And then if there's excess swelling, that shows that there is an accumulation of fluid. I should have said if there's a fluid accumulation, that's swelling in our table patella. Same thing with that sweep test. We're going to apply pressure, and then we're going to apply a little bit of pressure right on top of that patella. And any pain would be a joint effusion.
It would more be if the patella bounced back up.
If the patella bounces back up after that tap.
So like when it's doing that, if there's swelling or effusion, it's gonna pop back up.
Gotcha. The actual like kneecap bounces back up?
Yeah. So like
that's cool.
Because the fluid will go underneath it, so it's just gonna bring it back up.
Knees are, I've seen some post-surgical knees at PT clinics, and I always wanted to touch them to see what they feel like 'cause they're so big.
I know.
Respectfully. The bounce home test, we're gonna flex the knee up, and then we're going to bring it into extension, and then
Let it go a little bit more with your hand. There you go. Because what you're trying to do is get it to
bounce
see if
back.
it pops back up.
Because if it does pop back up, that's effusion.
Yeah.
So since hers is not bouncing back up, there is no effusion. We have our girth measurements, so that's where we're going to measure 3, 6, and 9 centimeters above and below the joint line. And that's a good way to compare it to the other leg to see if there's excess swelling. And this is really good for post-surgical analysis. We have our valgus stress test. So I'm going to do this at 0 degrees and at 30. At 0, we're testing for the capsule. We're testing for laxity. At 0, we're looking at the capsule. At 30, we'll be looking at the ligament. So we'll do the valgus stress test first. I'll bring her up. For valgus, I am going to slightly externally rotate.
That's for the, what's it called? McMurray's.
Gotcha.
I'm not trying to externally rotate anything right now.
Okay,
If that
here,
makes sense.
that's good to know. Here, we're just going to, for the valgus, we're going to pull out.
And push it in. So what you're trying to do is get this gapping right here. So,
Should I push with this?
You can have your hand more like that, up here.
Oh.
So like put it right there. You don't have to palpate anything. So what you're trying to do is get gapping right here to check for MCL. But you can have your hand, I would put your hand like that,
Like
and you're
this?
gonna push that, my foot that way, and then you're gonna push this more this way. So try to great gapping, if that makes sense.
Gotcha. Okay, so varus will go here, valgus here.
Yeah.
I see what you're saying. Okay. Create the gap. Okay, that makes sense. Oh, and so we'll do it at 0. That would be like here.
Yeah. Just make sure the leg's straight.
Leg straight, and then we'll go to about 30.
Yeah, that's good.
Valgus, varus. Okay. And then we have posterior and anterior drawer tests. So I am going to sit on our patient's foot here. And for posterior drawer, we're going to find that joint line. And then posterior drawer, we are going to push our force straight into her leg as such. And then for anterior drawer, we are going to pull forward anteriorly. And we're looking for any clicking or catching.
No, let's just checking to see if it's.
Oh, we're looking to see if the tibia keeps going. That would be a positive. But
Yeah.
since
So
it-
what does the posterior drawer test for exactly? Which ligament?
posterior drawer checks PCL
Uh-huh.
to see if the PCL is intact, because otherwise it would just keep going if it weren't.
Yeah,
and the
I get that
anterior drawer is the ACL
Yep.
to make sure it's
Okay.
intact. Posterior Lockman's, that one's fun. Okay, so we're gonna have hands on distal thigh, just over the patella, and this is the one where we are going to. Actually, we're going to have our leg under our hamstring. So I'll put that there. This is posterior Lockman's. And I will be driving down on the tib 2, I believe, with the web.
Hold on. Let me look this. I don't think that. Is that right? I think you're right. Yeah, you should be good. Yeah, you're good. Alive.
I think I have to stabilize
Stabilize,
here, and then I push down. And this is going to check for the PCL. If the
Yeah.
PCL were not intact, that tibial tuberosity would disappear.
Yep.
We have Godfrey's 90-90. So I will have you flex your knees here at 90. And then I'm just going to look at her tibial
Yeah,
tuberosities.
let go of that arm though, so it's see if it actually drops. Yeah.
Oh, there we go.
And then if it drops, that's the PCL.
This is the PCL. Okay, gotcha.
Yep.
Hers are perfect.
Yep.
PCLs are intact. In that position, I'll have you do the posterior sag test. So we're gonna have the patient flex her knee and then contract her quad as she drives her heel into the table for a few seconds. If the tibia disappears, or posterior translation of the tibia, while the quad is contracting, that indicates damage to the PCL. Lely's test, the gold standard for ACL testing, is when we take our fist, I'm gonna put it underneath her quad, underneath the middle of her quad, and then I'm going to push on the distal quads to see if that leg kicks up, to make sure that there's no ACL damage. We have anterior drawer test, which we did with the posterior drawer test. Interior Lockman's different from posterior Lockman's. Interior Lockman's is like our torque test that we did in a previous video. So with this one, we are actually just gonna leave that leg straight. And I'm gonna take one hand, place it around the distal quads, and then place another hand just below the knee around tibial tuberosity. And we are just going to go up with one hand and down with the other. We're gonna try to create that gapping to make sure everything is intact there. This is the anterior Lockman's testing for ACL. We'll do Steinman's test.
Do Thessaly's first. We'll do Thessaly's. We can do Thessaly's and
Do you want to do this at the end, or?
No, it's okay.
Okay.
Just go in order.
Okay, yeah, that's what I figure is the easiest. We'll do Thessaly's. So this is gonna be our fun one. So we're gonna have our patient go on one knee. I'm gonna hold her and we're gonna go internal and external rotation of the knee there to check to see how if our meniscus are intact. Pain would indicate potential meniscal tears or ruptures. And then we have Steinman's tenderness test, which is where we're going to flex our patient's knee up, and we're going to passively move them into tibial external rotation.
This is the ice cream scoop, so make sure you have the hand here.
Ice cream scoop, so we're going to apply pressure here at the distal quads, and then also here at the heel. This is the ice cream scoop one. So we're going to think about driving down with this left hand, driving in with that right hand, and then scooping down there. So do that one more time. We then have McMurray's test. So we'll start in flexion. And we have McMurray's, so we have McMurray's valgus and varus. So for valgus, we are going to put our force on the MCL, and we are going to take that leg externally rotate it a bit.
Externally rotate the tibia, and then you'll do the valgus movement.
And then we'll valgus movement and down. And then for varus, bring it in and down, just like that. One more time. And apply that varus force. And bring it down. McMurray's test. We're looking for the catching or clicking, which is the #1 sign and symptoms of ACL?
Meniscus.
Meniscus.
These are all meniscus tests right now.
I missed that on the quiz last night. So I learned it now. Okay, pinch aptly compression test. So we're gonna have the patient on their stomach, and we are just going to apply a force to their heel and internally and externally rotate the tibia while pushing down. This is again a meniscal test, checking to make sure everything's intact, no pain, no clicking. Means no meniscus problem. We can do the pinch test next. We're gonna place our thumb, we'll do the pinch test. So we'll do this either in both joint lines or just the one joint line that is injured. So this is lateral.
Go more to joint line. So put your hand more into like that area, and then just pick. You can do lateral meniscus. Say that's the one that's hurt, and
Okay.
then you'll just flex and bend my knee. Just that.
That's enough pressure there.
Yeah.
Awesome. And again, pain would indicate something wrong with the meniscus. There was no pain there. It's flexion and extension.
Okay, explain duck walk. I ain't doing it.
Yeah, duck walk is when our patient goes into a really, really deep squat, butt to the ground or as close to, and they're gonna walk towards you. Pain in the joint line when getting down into that position, increased pain with the duck walk, inability to get into the position is meniscus pain. I would demonstrate that, but we know what it looks like. And,
You're good. Don't demonstrate it. It's okay.
I also have a little bit of patellar tendy. It would not like that. Okay, so we just have a couple more. We have patella tendon length tests. So we're just looking for a ratio greater than 1 or less than 1. We are going to measure tibial tuberosity to inferior border of the patella, and then inferior pole, and then inferior pole to the superior pole. A ratio more than 1 is alta, and a ratio less than 1 is baja. We have the patellar apprehension. Both of my thumbs are going to be on the medial side, or the medial border of the patella, and then we are just going to push laterally to make sure that the ACL, the patellar tendon is tracking correctly and that there's no pain with that.
Yeah, that one's checking for subluxation. So
Subluxation, and that is...
It's where it dislocates pretty much.
Okay.
Checking for dislocation and see if...
Okay, ACL, they got dislocation. Okay, patellar grind. No one really likes this one. This was the one where we are going to have, we're going to start in full extension. We're going to use the web space of our thumb on the superior border. We are going to push down, and as we're pushing down, we're gonna go down and like in, right?
Yes,
Or am I
you're
just pressing down?
pushing, you're trying to push that down that way.
And as I'm pushing down, I'll have her contract.
I will not be contracting the quads, but
In
yes,
theory.
I would normally contract my quads while your hand's still there, and then it would grind along my
Right.
thumb.
Yep. And that would not be comfortable.
And what does that check for?
That's gonna check to make sure that our patellar tendon
If there's pain, it's chondromalacia. So it's
okay.
your
That makes
cartilage
sense.
is breaking down on your knee calf, your patella.
Chondromalacia. Gotcha. I don't know why I missed that word.
That's okay.
That's a very standout word. So last two we have Renee's and Nobles. We'll start with Noble. All right. Yeah, we'll just start with Nobles.
Okay.
Patient's gonna be face down.
Laying supine is this way, by the way.
I don't know why I thought you were face down for this one.
Supine.
Shoot, yeah,
It's like
it's-
holding soup. So I'd be laying like this.
It took me a couple of, even like after years of working at a PT clinic, and sometimes I'd be like, just put face down, please. No. Put thumb on, okay, so this one, we're just gonna put our thumb on that lateral epicondyle,
You're
which,
really aiming just to put your pressure on the IT band. So
okay,
yeah.
so like right there is fine.
Yeah.
Okay, we're going to passively flex the knee and extend it while maintaining that pressure on that IT band area by our lateral epicondyle, and that is going to check for IT band syndrome. There's pain while going through flexion and extension. And then we're going to finally finish it off with Renee's test. So we're gonna have our patient, the same thing, I'm just gonna put pressure on the IT band area by lateral epicondyle, and I'm gonna instruct the patient to do a mini squat. Any pain there?
No.
No pain means no IT band inflammation syndrome. And that is all I have for you. Just gonna practice my duck walk.